It's the top of the hour, so we'll go ahead and get started here. I want to welcome everyone here to the NNLM Social Determinants of Environmental Health webinar series. We are so glad that you are able to join us today for this first session about environmental health literacy. I'm your host, Carolyn Martin, and my pronouns are she and they, and I am the Outreach and Education Coordinator for the NNLM Region 5. Assisting with technical aspects is Molly Knapp from our National Training Office, and my colleagues Carol Ann Curry, Emily Hamster, and Cecilia Burns are also here to assist. We have just a few technical items to cover before we get started. We do have a live captioner today, and closed caption has been enabled, and it's available by selecting Show Captions at the bottom menu. Depending on the size of your screen, you may need to click on the three dots where it says More, and then selecting Captions. All attendees have been muted, but we welcome your questions and comments in the chat at any time, and we will have some time for questions at the end of the presentation. Please be sure to select Everyone from the drop-down menu when posting your questions and comments in chat so that everyone can see them. We're recording today's session, and it will be available at various places on the NNLM website, including the accompanying series guide in about a month. As a reminder, by registering for this webinar, all attendees have agreed to abide by the NNLM Code of Conduct. It's a reminder that we are all here together professionally, and we want to be inclusive and respectful. Your cooperation is much appreciated. The Code of Conduct is available on our website, and the link is in the chat. This class is eligible for 1.5 Medical Library Association continuing education credits, which you'll be able to claim through the evaluation link that will have the MLA CE code. The session is also eligible for Competencies for Health Education Specialist, or CHES, C-H-E-S, just to know that you will need your CHES ID to complete the evaluation. And to claim it, you need to also attend the live session. The session CE is also eligible towards the Consumer Health Information Specialization, or CHIS, C-H-I-S, through the Medical Library Association. And speaking of that evaluation, your feedback matters to us and helps us improve future trainings. So please take a moment to complete it, whether you want the CE or not. And more information will be provided at the end of the webinar. I know that some of you are already familiar with us, but for those who aren't, I'd like to share a little about who we are. The National Institutes of Health is the nation's leading medical research agency. Many of you might be more familiar with the National Cancer Institute, which is one of the many institutes and centers at NIH. NLM, or the National Library of Medicine, is one of the 27 institutes and offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources like PubMed and Medline Plus. NNLM, the network of the National Library of Medicine, is an outreach program of NLM, working to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 NNLM member organizations. And here's a map to show you how our regional medical libraries are geographically divided. And if you would like to learn more about your region and how your organization can become part of the network, visit our website at nnlm.gov. The link is in the chat. Dr. Anna Goodman Hoover is a public health researcher and participatory communication scientist. Dr. Hoover studies health and risk communication strategies designed to ensure that the best available scientific evidence informs individual, community, policy, and practice decisions. She also works directly with local stakeholders on research projects intended to improve environmental health literacy and strengthen communication. Dr. Hoover's recent environmental health literacy research has surfaced stakeholder concerns about the need for more accessible, understandable, and useful health-related information to help people protect themselves from diseases that have been linked to exposures. The title of Dr. Hoover's presentation is Environmental Health Literacy, an Engaged Framework for Understanding and Action. Welcome, Dr. Hoover, and I'll go ahead and turn it over to you and stop sharing my screen.
Thank you so much, Carolyn. It is a pleasure to be here. I want to thank you all for having me. It is always nice to have an opportunity to talk about environmental health literacy, both with veterans in the field and with people who are new to it. So I'm just trying to change my screen here to make sure that we are looking at the correct one. 1 second. Let's do that one more time. You know, it always works so well right before you launch, right? And then it gets a little wonky. There we are. All right. So it is my pleasure to be here with you all today. Thank you so much for having me. Environmental health literacy is a reasonably young field, so it's exciting to get to talk about it. I'll be interested to hear if some of you have done work in the area, done work that you identify as being in the area, especially after we have this conversation, because my sense is that a lot of people are doing work that really falls under that environmental health literacy umbrella without necessarily recognizing it as such. So what I want to do first off is acknowledge that this work doesn't just take a village. This work takes many villages. We have been working in the environmental health literacy space at the University of Kentucky for more than a decade, and it's a labor of love that involves faculty, staff, students, and our community partners. There is no environmental health literacy without community partners, and that is the essential thing I want you to take away from this. Environmental health literacy is not a unidirectional concept. We need to learn as much about communities and the lived experiences of the people there as we need to share information about exposures and particular risks that people may face. We're going to talk about that as we go through this next hour, 40 minutes or so. But in the meantime, I want to recognize just some of the terrific community partners with whom we work, including Headwaters, Like and Knowledge, Appalachian Citizens Law Center, and Martin County Concerned Citizens, and so many more. So what I want to do first is share with you, or maybe just remind you of what the learning objectives are. This is an opportunity for CE credit for many of you, and I want to make sure that we're all on the same page about what we're hoping to leave with. I want to talk about the definition of environmental health literacy. As I said, it's a fairly young field, but in that time, we've already seen some evolutions in how we are defining it. I want to talk about why context is so important for environmental health literacy. It's not this core set of, things that you can check off a list. And here are 10 things to check off a list and someone is environmentally health literate. Context matters. And we're going to talk about why. And we're going to talk about how we do that work in a few minutes. I'm going to talk about some examples of engaged research collaborations in environmental health literacy. That engaged piece is so essential to understanding the context. I'm going to pose some big questions in the field that we're grappling with. Just about a week and a half ago, we had a workshop on environmental health literacy at the NIHS, National Institute of Environmental Health Sciences headquarters at NIH in their Research Triangle Park, North Carolina headquarters as part of a larger meeting. And we had some big questions that we wanted to ask about the field, and there are things I'd like you to think about as well as we move forward. And then we'll just go back over and review some key takeaways. So the learning objectives on the website, if you did your homework, we want to define environmental health literacy. We want to talk about at least 3 context-driven factors that influence environmental health literacy. And we want to be able to apply an environmental health literacy framework to build multidisciplinary collaborations. We always have that EHL lens when we're thinking about who needs to be at the table for these different collaborations, these different participatory research projects that we do. But to understand environmental health literacy, we have to first go back and talk about something that's probably a little more familiar to many of you who are on the phone today, and that is health literacy. Health literacy has been around really early 70s is when we really start seeing it emerge. And in recent years, it has been part of the big goals that the nation sets for itself, right? And Healthy People 2010 and Healthy People 2020. Both of those documents defined health literacy as the degree to which individuals, one person, right, have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So there's a lot packed in there, right? We're talking about individuals. That's our unit of analysis. We're talking about access to and use of information, and we're talking about appropriate health decisions. And I always wonder when we use words like appropriate, who gets to decide what is appropriate, right? So there are those who argue that health literacy, at least in its early sort of iterations, was very much about compliance. Do folks know enough to understand why they need to follow doctor's orders, for example? Do folks know enough to know why they need to eat 3 meals a day from, when I was growing up, the food groups, right? The pyramid, all of those things. Now it's the plate. So do folks know enough to be compliant with recommendations from experts, with sort of what those initial iterations of health literacy looked like? Then we started seeing some shifts in the 2000s, especially around 2007, I think it was. We had some writing from Nutbeam, from Nikki Lurie, from other folks who were talking more about a community-centered and more critical health literacy. That's reflected a little bit in the most recent Healthy People edition, the Healthy People 2030, where they've split it, right? They've split health literacy into two things. They talk about personal health literacy, which is the degree to which individuals, again, we're focused on that individuals piece, have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So again, that focus on individually, that finding and using information and services. At least we're not using appropriate, right? Right now we're saying it will help them make the decisions and actions for themselves and others. So that's sort of how that has evolved on the personal level. Then we have organizational health literacy, which Healthy People 2030 talks about as the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So there's this pivot where we're also including organizations like, for example, libraries, and how those organizations are making the information available. We'll talk more about this as we go through this, but it is a nice to see something that is a little higher on the social ecological model. And I, spoiler alert, I think you have a social ecological model talk coming up in this series. So there will be more about that later, I'm sure. But in the meantime, just know that we are starting to at least integrate into definitions of health literacy these higher level, more systems and structural pieces. So that's health literacy. Over the 50 years it's been around, and I say 50 years because, again, one of those first publications was the same year I was born, 72, so we're looking at 52 years now. We have seen at least 17 distinct definitions of health literacy being used. Many, let's say most of them, are focused on that information component. They also are focused on action, but that action, again, is often about compliance. Will you understand enough? Will you, once you access the materials and read and understand them, take your medication as the doctor ordered? Will you reduce the amount of red meat you're eating, whatever it may be, right? But there is a bit of that action orientation in there. Again, health literacy has been incorporated in Healthy People as policy benchmarks for the last 3 iterations. We know that health literacy correlates with key social determinants of health, such as, obviously, education, right? And we know that education correlates with other kinds of social determinants of health, such as socioeconomic status, rurality, a number of different dimensions of social determinants that affect how healthy people can be, because it affects their opportunities and constraints within the systems and places where they live. Again, context, right? So again, in recent years, we've seen that pivot toward critical health literacy that incorporates context a bit more. If you want to see a really good sort of overview of the first 40-ish years of health literacy, some colleagues here at UK, Jeff Huber, Robert Shapiro, they wrote a really nice review, gosh, maybe 15 years ago. And it really sort of sets up some of these issues that I just have to really highlight right now and don't have time to go into depth on. In addition to health literacy, we have this idea of environmental literacy. Environmental literacy is more in the environmental education space, right? So in health literacy, when we think about health literacy, we're also always thinking about health promotion specialists, we're thinking about health departments, we're thinking about medical organizations, right? Those are the folks who are on the front lines of health literacy. But when we think about environmental literacy, it's more of an education approach. The North American Association for Environmental Education calls environmental literacy the knowledge, skills, dispositions, and behaviors to competently make decisions and act on local, regional, national, and global environmental issues. So it doesn't explicitly call out the individual. It recognizes that the challenges being addressed are structural and systemic, and it's recognizing that you have to have a combination of not just information, but dispositions and behaviors, right? So it's operating in a little different plane than health literacy is. In the California Environmental Health Literacy Environmental Literacy Task Force a few years ago, they had a report that called it the capacity to act individually and with others. So the California Environmental Literacy Task Force explicitly calls out it's not just one person. Again, it takes a village. So the capacity to act individually and with others, it also foregrounds that word act. It's not to know, it's not to understand, it's to act. And what do you need to act, right? What you need to act is the knowledge, skills, and understanding to analyze the issues and make informed decisions. So you've got two very different types of literacy when you look at health literacy and environmental health and environmental literacy. You've got different sort of paradigms guiding those specific fields or subfields. So all of this is going on and swirling around the 2000s. And the Society for Public Health Education says, okay, let's put them together, right? We've got this, let's come up with this environmental health literacy. And they, on a website that is now 404 non-compliant or whatever you call it, they defined environmental health literacy, one of the first definitions that you can find anywhere, integrates concepts from both environmental literacy and health literacy, so it's calling out its parents, right, to develop the wide range of skills and competencies that people need in order to seek out, comprehend, evaluate, and use environmental health information to make informed choices, reduce health risks, improve quality of life, and protect the environment. So it's really trying, in that earliest SOPHE definition, it's trying to bring together the best of both worlds. Skills and competencies are really about acting, right? So it's kind of foregrounding the acting piece. It's talking about comprehending. It's talking about evaluating. It's talking about more than just understanding or knowing. So environmental health literacy is already starting in this place that is more action-oriented than the earliest days of health literacy, where it was a very individually action-oriented. They're looking at broader concepts. Simultaneously, excuse me one moment. Simultaneously, the National Institute of Environmental Health Sciences recognizes that they have a whole lot of programs that are interfacing with key publics in communities, and particularly environmental justice and underserved communities. So they develop, NIHS, one of the NIH institutes, developed this umbrella organization within an organization. And that umbrella is the Partnerships for Environmental Public Health. The Partnerships for Environmental Public Health really strives to support research translation and making sure research moves into action to reduce risks in the real world. That's sort of the overarching goal. And again, within NIHS-funded research portfolio, there were already a lot of groups doing this, including community-engaged research to action grants. There are a number of centers that the NIHS funds nationally that have either research translation and or community engagement components. And those include groups like the Superfund Research Program, the Environmental Health Sciences Core Centers, the Breast Cancer and the Environment Research Programs, the Children's Environmental Health Centers. All of these have some component whose job is work with communities to figure out what they need to reduce risk and support them in their efforts to do so. And that is, again, sometimes it is translating that research and sometimes it is engaging those communities. So PEPH, Partnerships for Environmental Public Health, comes along and says, you know what? Not only do we have people doing this, we have people who are essentially doing what Sophie is calling environmental health literacy. So let's try to coalesce the people who are doing that work. Let's try to bring those people together to learn from each other and really advance that field. And in 2014, 10 years ago, NIHS PEPH hosted its first webinar on environmental health literacy. At the time, I was in the research translation core of our UK Superfund Research Center. And I got a call from the program officer who said, we're going to do this, and we'd like you to talk about environmental health literacy. What I was doing at the time, I felt, was environmental health communication. I worked with our research translation core in our Superfund Research Center. I worked to advance, bench science and into practice, into policy. Those are sort of the goals, into communities, making sure people have the latest, greatest information to help them make decisions. And Liam said, look at the definitions of environmental health literacy. That's really what you're doing. Will you have this conversation? Will you do this webinar with us? So I did. Michael Pasciorlo was the expert on health literacy, and he set up, this is health literacy, this is the past. And then I talked about environmental health literacy and the different components of it. We had a fun back and forth about whether environmental health literacy was a component of health literacy or its own thing. It was a lot of fun, and it really did bring together a number of people who were working in this area and get us all thinking about things maybe a little differently, maybe giving us a framework by which to do this work moving forward. Later that year, a panel of grantees from NIHS came together to present at the American Public Health Association. If I'm remembering correctly, I believe that was NIHS chaired the panel. Their program officer did. University of Pennsylvania, I believe, was there. University of Arizona, UK, maybe University of North Carolina. I can't remember for sure. But the important thing to know about this watershed year, this 2014 watershed year in environmental health literacy, is that prior to 2014, there were 2 publications that cited environmental health literacy, that talked about environmental health literacy. In that 2-year period after this watershed year where we started coalescing things, that number tripled. 6 publications were published in 2 years after just 2. Right. In all of history, 2, now we've got a 2.5-year period where we're publishing 6. Well, that's great. We're starting to move forward. We're starting to build some momentum. In 2017, the NIHS program officer, who had been trying to pull people together around this, and another program officer at NIHS came together to write an important paper. This is really one of the foundational texts in the field. And it was really laying out their vision of what environmental health literacy was and could be to the field. What they did in this paper was they adapted Bloom's taxonomy. Does anybody know Bloom taxonomy? Can anybody raise your hands or give me a thumbs up or anything so I can see folks kind of are aware of? Yeah, we see some folks who are. Okay, for those of you who maybe aren't, Bloom's taxonomy is from the education literature, and it's really this framework for student learning. And it goes from multiple stages, from recognizing an issue, and then you learn a little more about it. You're able to understand it in a little more depth. And then you're able to apply it to a real world situation. Then you can use it to analyze situations and evaluate choices. And then maybe you can create your own choices. So Finn and O'Fallon in this watershed paper in 2017 say, okay, if we're thinking about environmental health literacy within an educational framework, an individual educational framework, let's use Bloom's taxonomy and recognize that for every problem, you don't have to go all the way up to create, right? Sometimes all you need to know is this is a dangerous thing, avoid it. If you can recognize, oh, there's potentially cured in place contaminants, piping contaminants coming out of that manhole, I'm going to walk over on the other side of the road so I'm not breathing that in. That's just something you need to recognize. You don't have to create to reduce your risk. Maybe there's a community planning component, though, where we need to bring together people and come up with some new policies that we've got to create. So it's just that this particular table that they developed wasn't meant to be prescriptive, but it was meant to illustrate that there are different levels for different problems. And asthma may be a create in one community, or it may be a recognize in another. Again, it's that context piece. So Finn and O'Fallon define in 2017 environmental health literacy as an understanding of the connection between environmental exposures and human health. It distinguishes between basic levels of understanding and more advanced environmental health literacy that leads to action. Some of us working in the field said, well, that's nice, but that sounds an awful lot like the initial health literacy. It sounds an awful lot of individually focused, and we didn't feel like there was necessarily that action component as front and center as in the work that we did. So my colleague at the University of North Carolina, Chapel Hill, in 2018, the year after that Finn and O'Fallon paper was published, wrote a paper about the evolution of definitions of environmental health literacy, in which she posited that, yes, awareness and knowledge and even skills and self-efficacy are components, but community change is also a component. That means that people have to work together to make community change, and it also maybe changes the level of analysis, does it? I mean, are individual components what we're really wanting to look at, or are there broader community markers we need to be examining? The next year, Finn and O'Fallon decided it was time, we had enough literature in the field, that we needed the first textbook setting up environmental health literacy. And this is it. Sima Finn and Liam O'Fallon editors, Environmental Health Literacy. And I was privileged to be asked to write the first chapter, which was defining environmental health literacy. And I tried to pull together all of these strands to make it clear that it was a moving target, and B, it's not just about individuals, and action is central to it. So the definition that I came up with was environmental health literacy is an emerging and evolving multidisciplinary field. So recognizing again that this is not set in stone, that seeks to better understand how individuals and communities make sense of and act on health-related information about environmental hazards. So I'm bringing that information component back in. Why? Well, my background is in health communication and risk communication. So I like having that information component central, right? We want to recognize that people can access information in a number of ways, but do they know what to do with it when they get it? Do they know as a community how to coordinate around the latest information? So this was sort of where we landed in the first chapter of that environmental health literacy textbook. After the Finn and O'Fallon publication that I showed you a moment ago, in the 7 years since, we've seen more than 40 publications in the field. So again, we went from 2 publications in all of history up until 2014 to 6 between 2014 and 2016 to more than 40 being published after 2017. So we're now somewhere in the 60-ish, 70-ish. We are working on a scoping review right now. We're actually in the final stages of it. And we, by the way, we worked with a brilliant medical librarian. I cannot sing her praises highly enough. Her name is Kayla Robinson here at UK. She captured everything that could possibly be. I mean, we started with something like 24,000 potential hits, and we have been screening through them for several months, but we're almost there. So, you know, I want to thank those of you who are medical librarians from the bottom of my heart, because you're incredibly helpful in making sure that we don't miss anything that we should be capturing. So I've kind of given you the evolution of definitions of environmental health literacy, and selfishly, I'm going to leave you with mine as the last one you get. But environmental health literacy, in doing what those definitions said it will do, draws from a number of disciplines. There is content related to toxicology. You know, how do specific chemicals interact with your body, right? That's something that people might need to know. Medicine, public health, engineering, how do we remediate or mitigate against potential environmental health threats? Ecology, geography, policy. There are so many areas of content for environmental health literacy that you cannot possibly come up with a list of 10 things and say, know all these things and you are environmentally health literate. But importantly, we also have a variety of frameworks that we use to do work in environmental health literacy. I'm going to call those first three the communication grouping, because they all sort of derive from the communication field: health literacy, health communication, risk communication. Those all sort of ride together as communication-oriented frameworks. There's also participatory action research, things like community-based participatory research. And then you have experts in science, technology, engineering, and math education. These do not exist independently of each other. People doing work in environmental health literacy often overlap in their work. So my communication research is almost always some level of participatory action research, and often, especially if I'm working with my colleague at UNC, involves STEM education. My colleague at UNC, Kathleen Gray, her area of expertise is STEM education. So sometimes she'll pull me in to talk about communication. Sometimes we'll pull in other folks to work on participatory action research. And at the University of Arizona, that team does a lot of work in the area of participatory action research. Monica Ramirez Andriota and others. So we have these paradigms, they're overlapping, and we all sort of play in the same sandbox, and we leverage each other's knowledge and expertise. So there are certain concepts, for example, of talking from my communication paradigm, I'll talk about, well, we need to make sure people have response efficacy. And response efficacy, if anyone knows the extended parallel process model from communication science, is all about folks believing that doing the thing you're asking them to do will have a beneficial effect. Kathleen will say, we call that outcomes expectancy in STEM education. So even when we're working in parallel, we're doing a lot of the same things, but with different language. So as part of what we're doing with this current scoping review is looking at how the field is shaking out in terms of these paradigms and what we can learn from each other. Just to break down a little bit more in these specific frameworks that we use. Why a hammer and a nail? Well, because the reason I'm using that image is because I like the saying of, when what you have is a hammer, the whole world is a nail. So obviously I'm going to talk about health communication first, because that's my hammer. Health communication is the study and use of methods to inform and influence individual and community decisions to enhance health. What do we pull from in that paradigm? What health communication frameworks can we use? Well, exactly the kind of thing that I just mentioned: the extended parallel process model, the health belief model, the theory of planned behavior. We have all of these models and frameworks that have been used for health promotion and campaigns, communication campaigns, for decades. We have a lot of literature on what works and what doesn't. So we can pull from that when we think about how do we get people the information they need in a way that is preferred, right, through a channel that they would like to receive it, but also in a way that they connect with. We also have opportunities for audience segmentation and targeting. If I want to reach, 52-year-old female college professor like myself, I'm going to probably go to Facebook if I'm looking on social media, maybe Twitter, maybe, or X or whatever it is this week. But mostly I'm going to do that. But if I want to reach my 15-year-old daughter, you go to TikTok or Snapchat or something like that. So you can figure out where the people you need to reach about a specific problem are and package information in a way that is accessible to them. And then we can increase knowledge and promote health protective action using these lessons from health communication. Risk communication, on the other hand, has a slightly different history. It's really about a two-way exchange of information. It's about the population that is at risk and someone who knows something about the risk, right? So they're sort of having this push-pull about the nature, significance, and control of risk. And it's been really challenging in this field because in the earliest days, we were very much in a deficit model of risk communication. Well, people are worried about this problem because they don't understand it. If they just understood, if they just knew, right, they would feel differently or they would act differently. But over time, there were calls for more democratic dialogue and more interactive approaches to risk communication. So the field has, in the last 20-ish years, moved more to a best practices focus, where we think about hazard and outrage. And I'm going to talk a little more about that in a minute. But hazard being, what is the threat being posed by the environmental contaminant? And outrage being, how do people perceive that threat that is being posed? And that can really muddy folks' understanding of a situation. And then we also think about how we incorporate organizational sense-making into risk communication. By organizational sense-making, I mean, we understand the world not in a vacuum. We understand the world because of the things we watch and the people we talk with and the conversations we have. If I have an experience at a car dealership and I call Carolyn and I say, Carolyn, I've got to tell you about this terrible thing this car dealership did, then Carolyn may not want to go to that car dealership in the future because she knows what my experience is. Or she may say, you know what, I had the same kind of experience with them. Or she may say, I had a very different experience, and convince me that maybe they were just having a bad day. Whatever the issue is, it's that dialogue that informs both of our understanding of it. So when you're talking about risk, when you're talking about hazard and outrage, that dialogue is absolutely pivotal. So if we're going to build environmental health literacy, we can't expect that we're doing that in a vacuum. We have to understand that it actually requires some give and take. And then there's participatory action research, and particularly participatory communication, which focuses on multidirectional communication. We use visualizations, we use prompts, we use interviews, we use all kinds of stuff to facilitate collaborative decision-making. What we want to do is make sure that decisions people are making are, both appropriate for them individually and are culturally appropriate for their context. We want to help folks develop mutual understandings so that they can build social cohesion, right? I mean, one of the issues we run into very often is in communities where there are environmental health risks, you often have this kind of tension across people. So maybe one group works for the company that is under fire, and one group is very concerned about health issues related to what happened, and you get them in a room and they just can't have a conversation because they're in conflict. I think that extends to a lot of areas of our lives these days. So what we want to do is figure out, where can we start? What are those mutual understandings that we can use to help reduce conflict? We also talk a lot about the social construction of risk. So again, environmental health literacy is not a checklist. It's how risk is socially constructed and understood. And then we want to support action through collaboration. So why does all this matter? Well, all this matters because risks are place-based. I'm going to repeat that because it's really important. Risks are place-based, and so are the information and the available choices we have. Every site on here is a United States Environmental Protection Agency designated Superfund site. Superfund sites, we'll talk a little bit about the legislation that led to it in just a second, but Superfund sites mean that they're bad enough to go on a list by US EPA for cleanup, to be prioritized for cleanup. every one of these sites has a different combination of contaminants. Some of them, even in Kentucky, we have a Superfund site in the east that has polychlorinated biphenyls is the concern. We have a site in the western part of the country, or in the western part of the state, that has trichloroethylene and radioactive technetium-99 as the Superfund contaminants. We have a medical waste site. So there are a number of different kinds of contaminants. Why would people need to know about medical waste at the site that's just polychlorinated biphenyls? Why would we spend time concerning people about technetium-99 if they were only dealing with polychlorinated biphenyls? You have to tailor your EHL work to the contaminants of concern in the community. You can't expect somebody to come out as an expert in everything. Even the PhD folks I work with in the chemical sciences and environmental sciences and toxicology, they have areas where they are completely expert, but they are not experts in everything. So we have to pick our battles. And part of that is, what are the contaminants of interest? What are the exposure pathways? Maybe the contaminant only threatens health if it's ingested. So maybe I don't have to teach people about air quality related to this specific contaminant, right? Or maybe I don't have to talk to them too much about absorption because it's really about, did they eat or drink it? Or vice versa. Maybe it's only an inhalational pathway. And so I don't have to worry about talking about absorption or ingestion. So you've got to think about, what are the exposure pathways people need to understand to make decisions. And then there are socioeconomic and demographic factors. I'm not going to spend a whole lot of time on this because I know this whole webinar series that NNLM has put together is about this. But there are challenges related to education, challenges related to constraints posed by socioeconomic issues, challenges related to rurality. There are a lot of issues that need to be addressed in context. So that Superfund map I just showed you is the result of a lot of really complicated legislation over decades. I just told you why every site is its own set of challenges. Now I'm going to tell you some of the challenges that every site faces. And complex regulatory environments is one of the biggest. In 1980, after Love Canal and a few other pretty high-profile environmental incidents in the United States, Congress passed the Comprehensive Environmental Response, Compensation, and Liability Act of 1980. We call that CERCLA. We use a lot of acronyms in this field, and it can get really confusing. So we call this CERCLA. And what this law did was it established the liability of polluters. They're called in legalese potentially responsible parties, but it really means the people who are responsible for the contaminant being in the environment. This law authorized EPA and other agencies to recover damages, monetary damages, to pay for the cleanups. And it created the Agency for Toxic Substances and Disease Registry, ATSDR. Okay, so 4 years after CERCLA passes in the United States, a horrendous disaster happens in India. Specifically, there is a methyl isocyanate gas release in the middle of the night in a low SES area called Bhopal, and thousands of people die in the middle of the night. It becomes apparent when this happens that people didn't know what the potential contaminants were that they were living near. They didn't know what the potential health damage those contaminants could do. The physicians didn't even know what or how to treat what they were seeing when people started coming in. So this really raises alerts globally. So when it comes time for CERCLA to be reauthorized, Congress goes a little deeper, and partially in response to what happened in Bhopal, because they're understanding now that people need information, right? It's not just enough to say, trust us, we have this big chemical factory right here, you can just trust us. So SARA, the Superfund Amendments and Reauthorization Act of 1986, increased state involvement in Superfund processes. It increased the focus on human health, and that includes funding a Superfund research program at the National Institute of Environmental Health Sciences, which you may recall from earlier, I've been working with for a while. They also passed the Emergency Planning and Community Right to Know Act, EPCRA, which says, there are local and state involvement in emergency planning has to happen, and the public has to have access to risk information on the chemical hazards in their communities. So you see the evolving legislative context, but it keeps adding complexity. It keeps adding new acronyms for people to learn, right? So at this stage, we're thinking about what is involved. Well, we know that US EPA oversees environmental cleanup activities. We know that ATSDR investigates public health impacts. The U.S. Department of Energy and also the U.S. Department of Defense is responsible for a number of Superfund sites nationally. Then we have these state agencies that get involved, like Departments of Environmental Public Health, Departments of Environmental Protection, and Departments of Public Health. And then we have community advisory boards who get involved, and people are just left yelling help. There are so many acronyms. There are so many people in my face with so much information. And the information, by the way, is not always aligned. Sometimes it's conflicting. So we have to understand that this is the context in which people are trying to understand the threats to their health, the environmental threats to their health. They are trying to make sense of how they can protect themselves, their families, and their communities in this very complex set of situations. Same time, I told you we'd come back to hazard and outrage. Okay. There's this idea of different perspectives on risk. First off, everybody has a different risk tolerance. If we didn't learn that during COVID, we didn't learn anything. People have different risk tolerances. But risk assessment is a way that we go about quantifying, or in the case of this matrix, qualifying potential health threats and the priority we should give them. So this is how a risk assessor tends to think about risk, a technical expert in environmental management. The probability of something bad happening and the severity of the consequence. So if the probability of a methyl isocyanate leak in the middle of the night is almost certain, and the severity of the consequence is thousands of people die, you're in that upper right corner and things are critical and you have to prioritize and deal with that right now. If, on the other hand, the probability of exposure to another contaminant is very low in this community, and there's no risk if you are exposed to it, the meme about dihydrogen monoxide, which is water, right? There is not being any risk, then they would be in the bottom left corner. Most things are somewhere else in that matrix. But this kind of thinking helps technical experts and scientists prioritize what do we need to deal with right now. However, that's not necessarily how community members think of the risk. There are these components of outrage that Peter Sandman talks about. And I got to tell you, I don't love the binary of hazard and outrage, in part because I like to say, if you want to see somebody outraged, let a technical expert think their opinion isn't being respected, because I've seen that pretty outraged. But these components of outrage are really part of what drives our emotional reaction. So is exposure to the hazard voluntary? In the bottom left here, I have a picture of folks in Michigan protesting the idea of waste coming from the East Palestine, Ohio train derailment into their communities, and they're protesting. Their exposure to the hazard was certainly not voluntary. Does the individual have control over exposure to the hazard? Clearly, they do not perceive that they do. Is the exposure deemed fair? Often that is about who benefits and who pays for it, right? So clearly there's some issues there. And is the institution imposing the hazard deemed trustworthy? Often that institution is either a federal agency, maybe a state agency. I think we all know that trust in governance is fairly low right now in this country. So not necessarily deemed as trustworthy as we might want. So in addition to all of the contextual factors, in addition to the overarching picture of legislative and regulatory complexity, and in addition to this risk, hazard, and outrage context, in this area, we are now trying, with all of these things going on, to help people learn what they need to know to protect themselves and their families. And that is really challenging. So we impose that sense-making framework that I mentioned over the top of it. Again, we base our understanding on our conversations with others, on our interactions with others. And it's often based on our past experiences. It's based on, are we talking to people who are different from us, or are we talking to people who are just like us? That's called capacity. If I'm only talking to people who have had the same experiences, if I'm only talking to people from Appalachian, Eastern Tennessee, grew up there in the 1970s and 80s, and went into academia, then we're going to miss the forest for the trees. We're going to miss a whole lot of things via blind spots because we just don't realize what we don't know. But if I've got a variety of people from different backgrounds, we can think through, okay, what do we really need to know? Commitment is when someone sort of plants a flag and says, this is how I feel about this. So for example, if someone says this plant is killing us at a public meeting, it becomes very difficult for that person to accept evidence to the contrary. Or if someone stands up at a meeting and says, this plant is perfectly safe, it becomes difficult for them to accept evidence to the contrary. So that commitment piece. And then what do we expect to happen based on what happened the last time we dealt with a state or local or federal agency, or the last time we had a contaminant of concern in our community? And it's bringing everyone together. So when we think about environmental health literacy, I know you're going, what does all of this have to do with environmental health literacy? It's because these are the kinds of things we have to think about when we are designing research studies, interventions designed to build or assess environmental health literacy at both the individual and the community level, because none of it happens in a vacuum. So I want to share with you just a couple of examples. I know we're down to the last few minutes here. So I want to share just a few examples of work we've done at the University of Kentucky related to environmental health literacy. And this work spans longer than the field that I've been talking about, but it's in the wheelhouse. So our Superfund Research Center has always used interviews and focus groups and different kinds of projective techniques to figure out what people need to know. Those EHL knowledge gaps. We didn't always call them EHL knowledge gaps. You know, early on we said, what do people need to know? And that was just our list of what people needed to know. What we do is we identify who are the stakeholders in the communities where we work and what information do they need to inform, to make informed decisions. We try to recognize where people's values and information preferences align and where they diverge. To try to minimize that conflict that comes out of commitment, that comes out of perhaps some past expectations. And then we work with stakeholders who actually live in these communities to develop targeted and appropriate knowledge and skill building tools and materials. Another project we worked on was related to that Superfund site I mentioned in Western Kentucky. We were looking at what is the best future use for this site, not the best that we think, or the best that the Department of Defense thinks, or the best that the Department of Energy thinks. What does the community think is the best potential future use for this site? So we did semi-structured interviews. In those interviews, we started working on stakeholder identification and segmenting those stakeholders into different groups. We empaneled community research process input groups. We developed, you see in front of you, these bottom two pictures are future use visualizations of different potential futures for that site. We had focus groups, we had community meetings, we had an online information portal. And just in the stakeholder group area, we found, more than a dozen potential stakeholder groups who needed to be at the table, helping us think about what are the knowledge gaps, what do people need to know. So we found these folks related to this issue. In terms of knowledge gaps, people wanted to know what chemicals are out there at the site. What do those chemicals do to health? How much groundwater contamination is there? How are they monitoring the waste? They was unclear. They weren't sure who they was, but who were they? And how were they monitoring the waste? Could an earthquake, because this is near the New Madrid fault, could an earthquake disturb the waste? Why doesn't the contamination keep seeping south? Could we put a wind farm on the site? And how does the site affect my cancer risk? Those are questions people had relevant to this very contextually specific site, specific set of circumstances, and within the constraints of the overall legislative and regulatory framework. Another study we did, this one was for EPA. We looked at post-crisis preparedness planning. We needed to ask people what do you need to know to trust, for example, water again after it has been contaminated. So we had a case study in which we made a scenario, which was there has been an intentional biological contamination of the water system. And now it's cleaned up. It's moving back to baseline. People can drink it again. And we created radio stories, multiple radio news articles with different components of best practices for risk communication. Some of them were culturally competent and mentioned different media outlets and language services. Some of them had advice from the water utility system. For example, there was a spokesman who would say, be sure to run your tap for 5 minutes to make sure that everything's cleared out of it. So there were a number of these, and then we would have different focus groups listen to different components and see what they were missing. What information did they feel like they needed listening to these pieces? We found a number of stakeholder groups. Promotores and community health workers were really important for reaching elderly folks, for reaching people who are non-English speaking. We found African-American homemakers were central to a community we were working with in northern Fayette County, Kentucky. Millennials, are they processing information different? You can see we had a whole lot of different stakeholder groups. And they had a different set of questions, right? They had a different set of questions. What are the national drinking water standards? How is the water tested and who does it? This vulnerable populations issue keeps coming up. I think that's worth noting for the health promotion folks out there. I don't think we're very good at explaining that, because they keep asking, not only in this, but in other studies we've done, if water isn't safe for pregnant, elderly people and children to drink, why is it safe for me to drink? I'm not going to drink that. So we're not very good at communicating across the lifespan. My favorite question we have ever gotten in any of these sessions. It was 2 years into the project. The project was winding down. It was our very last focus group. And a homemaker asked, how do I clean my sink after I flush my pipes? I wash my grandbaby in that sink. 2 years of focus groups, 2 years of interviewing EPA, water utilities, all kinds of technical experts. Nobody had ever thought of that question. And that is why we have to value context. That is why we have to be respectful of the situations in which we are practicing EHL, in which we are trying to build the knowledge base and the skills that people need. And then we currently have ongoing research. I'm not going to talk a lot about this, but we are doing a community engaged study in Eastern Kentucky, looking at disinfection byproducts, which are chemicals that form in water when chlorine, or that is used to clean the water, chlorine products, interact with organic compounds, so like leaves or dirt or other things from the environment. And they've been linked over a long term to urinary cancer and some other outcomes. It's a long-term exposure. So we're working with this community group on this study. One of the things we're doing is we've got a stakeholder communication or a stakeholder consultation core that's driving a lot of the work around communication. And we've got a community science core that is driving a lot of the field sampling and training, and that is made up of community scientists. So one of the things we want to look at is those levels of analysis. Yes, we are assessing pre and post and between groups knowledge. Yes, we are assessing pre and post and between groups efficacy, but we are also looking at what participation in research and different kinds of participation in research due to social cohesion, due to networks within the community. So we found a number of stakeholder groups, again, different stakeholders from those other contexts. We're also finding that people who serve on consultation cores tends to be more connected already, because you're asking folks from local agencies, you're asking local activists, you're asking decision makers who can do something about it. Those are the folks you tend to invite to stakeholder consultation cores. As opposed, on that top picture, you can see how connected they are. On that bottom picture, you can see that if we're talking about community scientists, they are much less connected. And so that's telling us something about social cohesion. So by the end, are we able to build connections even deeper among these groups? Does that build community environmental health literacy in the form of social cohesion and the ability to take those action steps we talked about? It's really important. Now, as I'm winding down, I'm going to tell you these big questions we have in the field right now. These came up at our meeting just a week and a half ago. What do people need to know to protect themselves and their communities in the face of specific context threats? All right, we've talked about that. Who needs to be engaged to help build those competencies and capacities? I hope you're taking away from this that it varies from site to site and problem to problem. What is the appropriate unit of analysis? Is it the individual? Is it the organization? Is it the community? We've got to figure these things out. What are the appropriate outcomes and measures of success? How do we fund this work? Very often this work is funded through those centers that I mentioned, so it's not a standalone project. The work that I described for the Superfund Research Program or the Superfund Research Center is not an individual project. It's work that we do within the center. The last study I described is a Research to Action R01 grant, but the word environmental health literacy is not in the aims. The aims are to, about reducing disinfection byproducts, but we can work that in. We have other kinds of ways we're doing it. So a lot of folks work this into report back, evaluation of reporting people's results back to them. So have they learned something based on their individual results from participating in this study? And where do we publish the work? This is one of those new fields. It's an emerging field, and often those exist at intersections that are maybe too social sciencey for scientific journals, too scientific for social sciencey journals, right? So getting it published is sometimes a challenge because folks don't quite know what to do with it all the time. It's getting better. It's getting a lot better, as those publication records showed earlier. All right, so I know I'm over time. I'll give you 3 key takeaways. Environmental health literacy, this is your definition for your learning objective, is an evolving multidisciplinary field that seeks to better understand how individuals and communities make sense of and act on health-related information about environmental hazards. Context-driven factors, this is your second learning objective, that influence environmental health literacy includes contaminants of concern, potential exposure pathways, and socio-demographic factors, as well as regulatory complexity. And finally, using a participatory environmental health literacy framework can help you identify gaps in knowledge, what information is out there, what skills people need, what the community capacity is, and that can help you identify scientific and local expertise to help build the kinds of interventions and the kinds of materials and resources that can help build EHL. And with that, I want to thank you for your time. I have 3 pages of references, and I will turn things back over to Carolyn now. Thank you.
Thank you, Dr. Hoover. This has been a great presentation. I think we all had, it was great to hear about this changes in the field, and that I can just tell that people are probably thinking about how they can be involved, and because it is a multidisciplinary, multi-group field that I think affects a lot of people. So we want to have breakout rooms here in a little bit, but let's give you some time to ask some questions for Dr. Hoover. Go ahead and put those in the chat because we do have a large number of people attending. So, my assistants will help read those so that everyone can hear them.
I can't possibly have covered everything.
Yes, there are definitely loads of information, and I think there's a lot to take in. You provide us with a lot of things to think about.
Well, I'm glad. I hope I didn't throw too much at you. Oh, I'm so glad to hear that, Marissa. That's wonderful. I'm glad to hear about librarian collaborations. We have some of those going on too right now, especially around Radon, where we are working on library lending programs with 4 libraries in 4 counties. So we provide the radon detection kit, and then they check it out. And then if people, when they check it out, want to enroll in the study, they're welcome to, but they are under no obligation to do so. So it's been really a great partnership with librarians and environmental health scientists at UK. I'm so glad to hear that work is going on.
Yes, and Dr. Hoover, I think you mentioned that group also was a guest presenter at one of our previous webinars, and I'm going to go ahead and put that information in there, and that will have a link to the recording as well.
Awesome. Yeah, that's a really great study, and we've learned so much from working with libraries on that. It's been joyous. It really has.
Oh, here's one. What is the realistic possibility of creating a federal task force that conducts unannounced inspections in all kinds of industrial facilities and would potentially help prevent more unintentional exposure to contaminants?
That's a great question, and I don't make enough money to answer it. No, I'm kidding. I am heartened to see that we are seeing actual action on environmental justice issues, and I think that will help move us toward that. I don't think it's going to be a federal task force necessarily. That would require some changes in policies and regulations, I think. But there are federal task forces to discuss how the existing agencies can do it, right? And there is an environmental justice task force now that is largely with people from marginalized communities who are doing environmental health research work, and it is and advocacy work as well. And there is now, for the first time, an actual Office of Environmental Justice at EPA. You can go back to, the environmental justice movement started, well, I don't want to steal their thunder, but it started in the late 70s. And then we started seeing some presidential actions in the 90s, and then some more action a little later on. But in terms of establishing an Office for Environmental Justice, I think it's a big step toward that. I also think that, NIOSH and others and OSHA and those folks are always looking for ways to reduce different kinds of contaminants.
We have another one too. Are you able to give another example of sense-making processes in action?
I'm going to tell you something to read. When we get off of here, Google the Man Gulch disaster, Carl Weick, W-E-I-C-K. Carl Weick is one of the founders of sense-making. And this study looks at a wildfire. He looks at written documentation from a wildfire that occurred decades ago. And he talks about how sense-making broke apart because the structures that they were expecting, the roles that they had for each other and the expectations when they were faced with a catastrophic situation, they didn't know what to do. And so the whole thing fell apart. They couldn't make sense of the situation. That is a compelling read. It really is. And that is out there. The PDF of that is out there, and it is well worth your time. But there's also a great paper out recently from Matt Seeger on sense-making in Flint. I saw someone here was from Flint. Yes, Janice, Carl Weick. It's just type Man Gulch disaster Carl Weick, or Man Gulch wildfire Carl Weick. Oh, thank you. So I saw someone on here is from Flint. You might want to check out an article by Matt Seeger that is on sense-making in the Flint crisis. We have a sense-making paper in review right now. We have two in review right now. One is about the water project that I mentioned at the end there that we're doing, because both of the counties we're working in have a history of trust issues going back to some large-scale contaminations in the past. So we have a sense-making paper related to that in review, and we have another one that is about COVID response and vaccination. So lots going on in the sense-making space.
There's another one. For those working in community health in local settings, how can we make the largest impact for environmental health literacy in our communities? And I think we'll make that our last question before we go into our breakout rooms.
I think that's a really great and important question. I think finding out where people are. Do people, recognize, as much as I tease about the individual level, as a community health worker, you're working with individuals. So if you can look back at that table that that Finn and O'Fallon have, right, and figure out, do people recognize that there's a challenge with, say, infectious aerosols in tightly packed public spaces? Do they, I mean, that's a big thing right now. People don't necessarily recognize that that's an issue. Do they understand it? And then think about how to help them move to the next level. And it requires honing up ourselves, right? It requires using great resources like CDC. CDC has some wonderful resources. NIHS has wonderful resources on environmental health education. And then when you get people up to that sort of create level, that evaluate and create level, there are great tools, and I know you're going to hear more about them in coming seminars, like EPA's EJ tool, Environmental Justice Tool, which has maps that you can look at different components across your community. There's the CDC's New Environmental Justice Index. So there are lots of ways that you can move people along that ladder. You're not going to jump someone from recognize to create, right? But you can think about what are the relevant issues in my community and how can I share information? I hope that helps.
Thank you, Dr. Hoover. And I know we have just a little bit of time. We want to allow people to have some time to network and to discuss and learn from each other. So we're going to go ahead and start our breakout rooms in just a bit. But first, I want to say that it is time for our additional engagement, and each of our sessions will have different types of engagement, and today we will have breakout rooms for you to have an opportunity to reflect and discuss the presentation topic, as well as an opportunity to share your work in this area. We will end this part in about 5 to 10 minutes before the end of our time, and then we will provide the evaluation links for you to get your CE credit. And just to wrap up our time. So we encourage you to stay and participate. And before we go into those breakout rooms, I just want to review a few things. The questions that to help get you started there on the left. Each of the breakout rooms will have a monitor who will get the discussion going and moderate it. And during this discussion, I ask that you be fully present, that you use I statements, that you listen to understand and not respond, to use inclusive language, consider the acronym WAIT, why am I talking, and that stories stay and lessons leave. We want everyone to feel they have the opportunity to add to the discussion, that they are being heard, and that we respect each other's perspectives and trust each other's wishes for privacy. Hi, everyone. I hope you had a good chance to have a little discussion in your groups. I wish we'd had more time, but unfortunately, it goes quicker than I think. So I was glad to have a great presentation with Dr. Hoover and have the breakout time for all of you as well. So just a few items before we end the session. If you are interested in claiming the MLA CE credits, and just for this, the link is in the chat. And as you take the evaluation, if you answer yes to wanting the CE, please make sure to pay close attention as the CE code and additional instructions will appear. If you haven't already, consider registering for the upcoming sessions of the series. The next one is tomorrow, March 6th, starting at the same time as today's, and it is titled Counting Every Death When Every Death Counts, a Mixed Methods Analysis of Hurricane Michael Excess Mortality. And don't forget our accompanying guide. Each session has its own tab with information about the speaker and the links related to information resources. The recordings will also be linked there, as well as on our YouTube channel. And I will add Dr. Hoover's slides and some resources that she had sent to our guide. And some of these guides will be changing as we add more information. So you might want to check on those every now and then. Links for those and the next session are in the chat. And remember that for social media posts about the series, please use the hashtag SDOEH24. So thank you all for attending and participating, and to our guest speaker, Dr. Hoover, for this wonderful and informative presentation. We hope that you can attend future sessions. Have a great rest of the day. Thank you.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.